The last time we hosted you in July last year, none of us could have imagined that almost 18 months later, we would still be in the grip of the pandemic. More than 3.3 million people have lost their lives to COVID-19 this year, more deaths than from HIV, malaria, and tuberculosis combined in 2020. And still, COVID-19 continues to claim around 50,000 lives every week. There is now consistent evidence that Omicron is spreading significantly faster than the Delta variant. And it's more likely that people who have been vaccinated or have recovered from COVID-19 could be infected or reinfected. All of us are sick of this pandemic. All of us want to spend time with friends and family. All of us want to get back to normal. The fastest way to do this is for all of us, leaders and individuals, to make the difficult decisions that must be made to protect ourselves and others. In some cases, that will mean canceling or delaying events, just as we have had to cancel the reception we plan to have with you today. But an event cancelled is better than a life cancelled. It's better to cancel now and celebrate later than to celebrate now and grieve later. None of us want to be here again in 12 months' time. If we are to end the pandemic in the coming year, we must end inequity by ensuring 70% of the population of every country is vaccinated by the middle of next year. There is new evidence emerging now of its benefits, especially with elderly groups, senior citizens, especially above 65 and above 60. So if it's going to be used, it's better to focus on those groups who have risk of severe disease and death, rather than, as we see, some countries are using to give boosters to children, which is not right. Then the equity issue comes here. Instead of boosting a child in high-income countries, it's better to vaccinate the elderly in countries who have the elders who have not been vaccinated, even the primary vaccines. So the equity issue should also come into play.